Hiring for the Impossible, Building a First-of-Its-Kind Digital Health Revolution from Bottom Up, by Dr. Patrick Schur, Professor in Ethical Digital Supply Chains, EDSC, at the theCwindLab, founder of the Wind Solutions in California. In 1969, NASA put a man on the moon with less computing power than your smartphone. Yet today, if you collapse on a street corner, paramedics or doctors won't know your records. This is the paradox driving Dr. Patrick Schur, a man who sees healthcare's fragmentation not as a technical challenge, but a failure of imagination. With patents filed alongside his company and in collaboration with ETH Zurich and the W3C, he's built what hospitals refuse to adopt, a decentralized, persuasively following digital passport for human health. But technology alone won't change the system. You need the right crew, engineers who think like astronauts, prioritizing mission over comfort. Today, we listen in as Dr. Schur vets one such candidate, Anand Bhaskaran, a senior software engineer wrestling with the most dangerous question in tech. Healthcare innovation is often seen as a slow, incremental process bound by regulations and red tape. But what if the next revolution in medicine isn't coming from a lab or hospital, but from a complete reimagining of how medical data moves around the world?
What does it take to recruit for a mission that's never been done before? Not just another startup, but a fundamental rewrite of how healthcare data flows, decentralized, patient-owned, and globally interoperable on common denominators. Today's conversation isn't about job descriptions or salaries. It's about finding someone who sees the world differently, a builder who thrives in the void between what is and what could be. This is the story of that search. Anand, you've built tools for financial analysis and scaled B2B platforms. It's not about gate or doorkeeper or holder. But here's my question. Can you imagine working on something where data ownership isn't a feature? It's the foundation? Where the goal isn't to follow the money, but to redefine the paradigm and any resource perspective?
I agree data should be decentralized. To avoid duplication, give users control. But the legal hurdles?
Exactly. Legal inertia is the gravity we're fighting. NASA didn't wait for permission to go to the moon. They engineered around physics. Our challenge? Engineering around institutional resistance. Would you build something knowing it might not pay for years, but could change how 8 billion people access healthcare or the world? Imagine a world where your medical data follows you, like an astronaut's vitals streamed from space. No more static applications, screens, no mobile device dependencies, no fragmented records. Just continuous, personal, secure presence. That's the Bio Cross-Chain Collaboration Cooperation Coexistence OLO Internet Protocol, BCCCOP. Not another app, not another platform, not another device. A new internet layer that changes the definition of current interfaces to human to digital to human, H2D, 2H connections and interactions.
How do you even start building that?
Elon Musk says, the hardest part of spaceflight is convincing people it's possible. Like a space station, piece by piece, alongside the old system. We've reduced emergency room wait times by 30% in pilots. But this isn't about tweaks. It's about convincing developers like you to think beyond code, to see data as a human right. You mentioned scaling teams at Beekeeper, but scaling this requires something rarer, organizational bilingualism, speaking the language of hospitals and hackers. Most engineers chase mainstream tech trends. We need those who ask, what if the mainstream is wrong?
I mentor startups, but they're usually chasing revenue.
Revenue follows vision. Tesla didn't start profitable. Neither did Apollo. The question is, can you work in the dark before the world understands what we're building? You said you value truth and trust. But here's the conflict. Legacy systems trust, GDPR and HIPAA. We truth that it's obsolete. Would you prioritize technical elegance over compliance if it meant fixing a broken system?
It depends on the project. For me, money is somewhat important, partly because of the gifts and also because everything in Switzerland is expensive.
But really, it shouldn't matter that much, since you already have a 100% full-time job. If you're truly passionate about IT, about changing the world of IT, even taking on giants like Google, IBM, or Apple, then that's what should drive you. You're investing in things that follow the mainstream flow of money and operate within legal boundaries. And that's not what I'm looking for. This project is the exception. We're not just creating something. Like SpaceX reusing rockets, we're proving that ethical disruption is possible. But it demands builders who default to courage. Talent isn't the bottleneck. Conviction is. The next frontier of healthcare isn't AI or blockchain. It's rewiring trust. To the Anand Bhaskarans of the world, if you're tired of building for the status quo, the airlock is open. Read more under www.artofdigitalshadow.org.